And good afternoon, everyone. Thanks for joining us for this, our first COVID-19 press briefing of the week. Today, Orange County Mayor Jerry Demings will discuss our goals for the week, Orange County's efforts in assisting the state with the vaccination process, including important details regarding transportation, some challenges and opportunities. The mayor will also give an update on COVID-19 testing, positivity rates, information from our strike teams, and other programs as well. Orlando Mayor Buddy Dyer is here as well. He will discuss recently voted extension initiatives for businesses and residents in the city of Orlando related to COVID-19. And we have Dr. Raul Pino here from the Florida Department of Health in Orange County to discuss important details on the vaccination process as well as COVID-19 trending in our area. We begin with Mayor Demings. Mayor?
All right, good afternoon. Thank you, Dr. Williamson. Hopefully you all had a great weekend. I believe it was a good weekend for the state of Florida with the Tampa Bay Buccaneers making it to the Super Bowl. So go Buccaneers. I'm wearing my Buccaneer pin today to support, I'm going to say, our home state team. So, and obviously the Super Bowl will be hosted here in a couple of weeks, hosted in Tampa. So with that, that's good news. The win is historic for the Super Bowl because Tampa Bay will have a home field advantage. That'll be the first time that a team is playing in their home stadium, so well done. Now, let's shift a little bit and talk about our goals for the week as we continue to fight against the spread of COVID-19 within our community. We have a few goals. I'm going to go over the three top goals that we have. First, we will continue to assist the State Department of Health in Orange County in the distribution of vaccine to those 65 and older or emergency workers. Number two, we will work to get the vaccine out to senior living communities throughout the county. And number three, we will continue to offer free COVID-19 testing through Orange County Health Services at Barnett Park, and then, of course, the regional testing site continues at the Orange County Convention Center. Today is a big day at the vaccination site at the Orange County Convention Center. Right now, first responders are getting their second dose of the vaccine, which means they are done with their vaccinations. We'll talk more about that in just a few moments. Tomorrow, our residents will start receiving their second shots as well. So those who made appointments previously through the various portals will begin receiving their shots tomorrow. Dr. Pino has said to me that we have ample supply of Moderna and Pfizer for the second shots. The first shots, we'll see what happens with that as a state. But he tells us so far that the Orange County Department of Health has received over 95,000 combined doses of Moderna and Pfizer within our community. To be precise, he said we received 95,375 doses. And roughly 72,000 people have received a shot from the Department of Health for the vaccine. The number is really much higher in our community because it's very difficult for us to capture the number of doses that are being given in the community because of the VA hospital. We know that they are giving some doses there. They are not required to report into the state. That's a federal supply stream. In addition, it's sometimes difficult to keep up with all of the numbers coming in from the hospitals. For those headed to the convention center, I'm going to show a graphic up here in just a moment. There are a few things that we want you to know before you go to the convention center to receive your vaccination. And I might add, I received my second dose at the Orange County Convention Center, and I went through the line like everybody else did. And so I can tell you these three things that I'm going to share with you, make sure that you do. Number one, eat something before your appointment. 2, take your normal medication prior to your appointment. 3, arrive with a full tank of gas and no more than 30 minutes before the appointment. These are the things that we're asking and suggesting to our residents. For many residents who find it a hardship to drive to the convention center, as we announced last week, we have paramedics from Orange County Fire Rescue and paramedics from other municipal agencies going out to senior living facilities or communities, and they are taking the vaccine to the people who live in those communities. Last week alone, nearly 1,500 seniors were vaccinated by paramedics, and those individuals were able to receive the vaccine in their respective communities. The Orange County Fire Rescue teams are working out of the Fairways Country Club community in East Orange County today and are expected to vaccinate around 340 seniors. They will return to Fairways tomorrow and vaccinate roughly the same number of persons. For more information on the vaccines, please go to our website at ocfl.net/vaccine. Want to share with you some advice about going to the convention center. If you are using some of the ride-share type of companies such as Uber and Lyft, we want you to ask the driver to remain with you through the entire vaccination process before taking you home. I know this adds to the cost of the trip, but it is a safety precaution because we're asking individuals to really stay within their cars and to be able to be monitored for the 15 minutes or so afterwards and then be able to be taken back home. Also, Links is taking registered access Links clients from their residence to a vaccination site and back home, but you got to be a registered client. The Link service provider waits in line with the passenger so the passenger can get the vaccine. For more information, if you're a registered Links person, you can go to their website at golinks.com, golinks.com. Remember what I said on Friday. I said to you that we will likely reach the 100,000 milestone this week, and I am confident we will. There have been a total of 99,143 coronavirus cases reported in Orange County to date. A reported 895 Orange County residents have died as a result of the coronavirus. That's an increase of 2 deaths since our last briefing, which was on Friday. As always, we continue to hold the families of those touched by the deadly disease in our prayers. But we will continue to also offer testing in our community. We are pleased to announce the Barnett Park testing site will remain open until the end of February. Orange County Health Services operates the site. Those are county staff persons operating that site from 9 a.m. to 5 p.m., 7 days a week through February 28th. Residents can get a rapid or an antigen test or a PCR test or both. PCR tests are more accurate and the results are usually available within 48 hours. If you desire to be tested there, you can get information by going to ocfl.net/testing regarding the Barnett Park location. No appointments are necessary. To give you an update on the work of our compliance teams, they are now in their 135th day of inspections. The teams have visited over 6,600 businesses with an overall compliance rate of 99%. Since the citation and warning program began, remember I signed that executive order on December the 4th of last year, we have visited 1,284 businesses, so nearly 1,300 businesses have been visited and issued 93 warnings and 17 citations. I want to remind everyone also that I realize that many people are out of work. We shared with you this past Friday that there will be a job fair. We will be hosting the mayor's job fair this Wednesday in partnership with the Central Florida Employment Council. Over 50 Central Florida companies will be there, and they are looking to hire employees in the fields of healthcare, transportation, customer service, education, construction, and more. The event is free for job seekers and will be held between the hours of noon and 4 p.m. this Wednesday. Again, it will be at the Central Florida Fairgrounds at the Expo Park. I urge residents who are interested in employment to take advantage of this opportunity. They can get information through the website at cfec.org, cfec.org. And with that, I'm going to turn it over to Mayor Dyer at this time.
Thank you, Mayor Demings. I don't know if you that wear glasses have fogging problems and then sliding off problems, but I generally have those, so excuse me. I want to start by reminding us all that last week was a proud time for our democracy with a peaceful transfer of power at the very highest level of our country, and it provided an opportunity to look forward together to focus on unity and hope for all Americans. And as a nation and a community, we've faced adversity this last year, challenges throughout the pandemic, and it took us all to get together united to continue to move forward, because if everybody in our community is not pulling in the same direction, it's going to be hard to beat this thing. We've taken the necessary and needed steps to keep ourselves and our loved ones protected from the virus and to get back where we can all gather again together. I want to again remind residents of the many activities we can do while still being safe and sticking to our pandemic precautions. We're fortunate to have beautiful weather, unlike some other areas in the country, in January, so we can do all types of socially distanced things outside, go for bike rides, visit our city parks, and do all types of things that keep you not only physically healthy, but mentally healthy. We know it's going to take time to eradicate the virus by stopping the spread, and vaccinating is going to take several months. And we aren't going to return to normal with a snap of the fingers. So over the next few months, we have to continue to take personal responsibility to ensure the health of our community and our economy. And we took some additional steps today at City Council to support our local businesses. And that includes continuing to allow parklets in on-street spaces, outdoor dining at the Osceola Open Air Hospitality Zone, continuing to allow outdoor sales, seating, and marketing in private parking areas and public rights-of-way that are adjacent to a business. We'll also continue to provide free parking validations through Park DTO through September the 1st, and we're extending funding to help downtown food trucks operate through September 30th. We'll also continue to suspend any permitting fees or applications that you would have to make for those programs. And also at today's meeting, we voted to provide rental assistance to more retail and consumer services businesses within the CRA. To date, that will allow us to have a total of 37 businesses, and we have provided more than $720,000 in assistance through this program. With that, Dr. Pino.
Mayor, thank you. Thank you, Mayor Demings, everyone. Well, some of the data is showing some positive signs, and I want to convey that to the community, although it is not time to relax any of our measures that we have in place by the CDC about wearing your face mask, washing your hands, and watching your distance. Some of the data improvement that we have seen relates to hospitalization, number of people in ER have declined, and also the positivity rate over the 14 days is slowly, very slowly decreasing every day. Also, our positivity rate, recovery rate has increased to 92%, and that's a reflection of the improvement in the data. We are reporting today that 895 people have died in our community. Our condolences to their families and friends. And also, since last we spoke to you, only has been 2 additions to the death numbers that we have experienced in our county. With regard to vaccinations, we continue to operate the site, and I wanted to share with you some of the data that we have been able to collect So as of today in the morning, 72,092 individuals have been vaccinated in our county with any of the dosage. 71,171 were residents of our county. And at least for the first dosage, 61,686 individuals have received those. That is a 4.8 of our population, so we are getting ready to hit about the 5% of our population immunized. Just to remind you a little bit on this data, although for this percentage we are including the entire population of the county, remember that we are only giving vaccines to 16 years and older for Moderna and 18 years and older for Pfizer. So even that we are including the younger population, they are not part of the universe that we are vaccinating at this point. So the rates could be a little bit higher if we just limit it to 65 years and older. But we are giving you the entire population because, we want to get to that magic 79% when we get there to achieve herd immunity. Also, as a note, 9,485 individuals in our county have completed both dosage, and that's a significant number to get there. It is important to cancel your appointment, especially this week. If you are not coming, cancel your appointment because the portal continues to be open, and those appointments will come available for people this week. And if you cancel future appointments, that will also become available when you open those weeks. As the mayor says, it's important for you to take your medication before you come to us, whatever you are taking that day, to eat. And also remember that we have placed potties at the end of the waiting line on the drive and also outside with the EMS provider. So we have provided toiletry services for you there for your needs. We advise that you do not walk to the site because, as the mayor said, the site is designed for vehicles. So it's really no space in the drive-through for people to walk, and we are concerned about safety. And as we said before, we are going to get to everyone. We just can't get to everyone at the same time. We have continued to receive sufficient supplies from the state for the second dosage that are scheduled, and we will continue to receive supply for the first doses. We are concerned, as everyone else, because we have heard the news at the national level of some limitation with the distribution and the storage of vaccines, but so far we have not experienced any lack of vaccines in our county, and we are not the only ones receiving vaccines in our county. Our county has received more than 300,000 doses in different providers across the county. And as we checked this morning, we were the second county after Miami-Dade by the amount of vaccine received. We will continue to provide those services at the Orange County Convention Center. We increased the appointments from 2,300 to 2,500 a day to compensate for cancellations and people who may not be showing. And the site is working just actually beautifully. At this far today, we have completed more than 1,400 vaccines, and we have a little more, over 1,000 to go. With that, I will answer any questions that you may have. Thank you.
Okay, we'll open it up to any questions. Just as a reminder, if there's any Spanish-speaking media here, we have the ability to do translations for you. We're joined by two of our Spanish-speaking commissioners, Commissioner Gomez-Cordero, Commissioner Uribe, and then we have Ms. Ilia Torres, who can assist with the translation as well. So with that, we'll open it up. The magical mic is over here, and it's always, I don't know how we always begin with Lauren Seabrook, but she's always the very, very first person. All right. Dr. Pino, that means you're up.
That's right.
You changed last week.
It's for you. Lauren Seabrook, Channel 9. Dr. Pino, with the first responders starting to get their second doses, and I know the general public over 65 is going to start tomorrow, so you probably have those scheduled out. Can you give us an idea of what percentage of first doses you're doing versus second doses a day, and if you've started to notice any issues having those appointments overlap, like if you're going to have to do fewer first doses because you're getting the second doses in?
So that's a good question. Part of, so we intentionally didn't reach the capacity of our appointments in the first couple of weeks because we knew that at some point we will have to compensate for overlapping. So all the appointments that we had added this week are first appointments, on top of the second appointments that we have for the first 16,000 Moderna that we gave out. So right now, every single Moderna second appointment will be this week, and then we added a quote of Pfizer to those first appointments. Because part of the concern is we concentrate, so it's interesting, what is happening with this vaccine, because they have different schedules, is that they could overlap in a negative way. Now, the CDC released information last week that both vaccines are safe to take at the 28th appointment a day, and they also, people don't have to restart the schedule if they go beyond the 28 days. So it's safe to receive your second dosage even beyond the 28 days if for any reason you can, and you don't need to restart the schedule. And for that, we add a first dosage so that we have a mix rolling over of first and second for the future appointments. No, right now, this week is more a second than first.
There are reports, and this is for Dr. Pino, I'm sorry, it's Amanda Dukes from Channel 2. Moderna has acknowledged that they are working on a different booster shot that could apply to this mutation of the coronavirus we're seeing in South Africa. Does that mean, Dr. Pino, there could be a scenario where people who have been vaccinated, gotten their 2 shots, might at some point have to come back to get another?
I don't know. So far, what the news and the reading that we have done, the vaccines continue to be effective for the variants that we have seen. What they are concerned, as I expressed for some of the scientists, is that the longer that we go into this pandemic, the more likely the virus is to continue to mutate. And it's the possibility that some of the mutations in the future may not be effective. The vaccine may not be effective for them. So that's also part of advising people to vaccinate as soon as you can have access to the vaccine. Do not wait. The vaccine is effective. It is effective right now as far as we know with those variants. And waiting could include the fact that the virus could become resistant to some of those vaccines in the future. But so far, we have been lucky that that's not the case.
Emily Braun, News 13. This is also for Dr. Pino. Dr. Pino, the White House says reportedly Florida received 2.9 million doses of the vaccines, and we've only vaccinated 1.5 million. Do we know where that other 1.4 million doses are? Are they spoken for? Are they being held as second doses?
I don't know what this. I don't have visibility. You know, I work for the state, but another state, and say that because it's always the same type of. I have no knowledge of that. In our case, and that could happen at the state level, is that yes, we are receiving, for example, I don't have the numbers in front of me, but we probably have right now on hand 57 dosages of both vaccines when you add it together. But we know that we have 70,000 appointments out. So the fact that we are holding vaccine is not because we are holding, it's because we are going to the rhythm of the vaccination schedule. And so weekly, we get what we are putting out weekly. But also this vaccine, especially Pfizer, has a lot of regulations on temperature, how long you have to defrost it, how long you can keep it out. So you have to have a rolling inventory of the vaccine. I suspect that could happen at the state level. Of course, a much larger operation. And in our case, our county has received over 300,000, but also it could be a delay in data entry. And that could justify part of the discrepancies. Not that large, but it justifies part of the discrepancies.
This is Melissa Thomas of Florida National News. This question is actually for Mayor Dyer. We've missed you for a couple of these press conferences, so I did want to ask you what the feedback is that you've been getting from residents and constituents in the city of Orlando as it relates to the vaccines. Have you heard any feedback in terms of allergic reactions, or have you heard of citizens that are relieved and kind of excited to get the vaccine? We just wanted to get your perspective on that.
No, it's been positive feedback. I think the process of actually getting your appointment has been a little difficult for some, and some we've opened our senior centers to help people make their way through that. But in terms of the actual process of receiving the vaccination at the convention center, I've heard nothing but positive comments from residents.
Nikki Zizazo with News 6. This question's for Dr. Pino. So Dr. Pino, several weeks ago you would mention how there was concern surrounding hospitalizations and how that was something you guys were really looking closely on, as well as the spike in positive cases following New Year's. What has that data revealed now? I mean, you mentioned that things are looking promising and things are looking better, but in terms of the public feeling, many people feel assured that because the vaccine's out, things are getting better. So how is that looking on both ends, hospitalization and the positive cases?
So, and that's a good question. So thank you for asking that question. So the public have to know that the vaccine right now is not making a difference at the larger level, at the population level. It's going to make a difference first for the people who are receiving it, and those are 65 years and older. And out of those, we have more than 200,000 residents, and we only have done 71,000 of those vaccines. So it's very early for the vaccine to have any implications in the whole pandemic. It will, and it will have an impact, but later on when we have larger number of vaccinated. I think the first impact, and it was on news about Israel, who have vaccinated very fast, and how they have seen a reduction of more than 20% on death rate on people who are of the age of 65 years and older. So I expected that the first, and I think I mentioned it before, I think the first indicator that this could have an impact is on our death rate. Because the state of Florida have making an emphasis in vaccinating assisted living facilities. We are making emphasis on congregating housing around the county and 65 years and older. So we are really targeting those who are at higher risk from dying. And that's where we are going to see the first impact. But people should know that we should continue to use masks, wash our hands, wash our distance. Even when you are fully vaccinated like I am right now, you should continue to wear these masks. Reinfections are possible. They are not common, but they are possible. And we don't know what the role of the vaccine is preventing you from transmitting to another person. And so those are things that we have to be careful about, and that's why it's important to continue to wear your mask. There's going to be more data coming about this. What are the roles of the vaccine in preventing you from being an asymptomatic carrier? There are many questions that still are not answered, and that's why we should continue to provide and protect ourselves with those practices.
Dr. Pino, if you don't mind just staying up there. Danielle Lama with Fox 35. I think you've gone over these numbers, but do you mind telling us how much vaccine the Orange County State Department of Health has received and how much has actually gone into people's arms? And then how quickly are you able to get through those batches? Is there ever a time where you're completely out?
No, we have never been out. I don't have the numbers in front of me. I should make a point to bring the inventory next week. But on the top of my head, Orange County operations at the Orange County Convention Center, we received 16,000 Moderna. We got the 16,000 doses for the second Moderna, that's 32. We got 19,000 Pfizer. We also got the second dosage for those 19,000. We got 9,725 another delivery, 7,895 another delivery, and we got a delivery today of less than 9,000. So we have received a significant amount. and we have never run out of vaccines yet.
Steve Hudak from the Orlando Sentinel. This is for Mayor Demings. Mr. Mayor, do you know what it's costing us to do testing at Barnett Park? Also, where's the money coming from for that, and why do you think it's important to extend it through another month? Because it was supposed to stop on the 31st.
There's still a significant demand for testing within our community. Individuals want to know if they're positive or negative, and so we want to make certain that we avail them of that opportunity in addition to at the convention center. The convention center is a regional site. The Barnett Park site really is for Orange County residents. Most of the funding so far has been CARES Act funding. We still have some residual dollars that we're spending there. But as we extend into February through the end of the month, it is likely that we could potentially be using general fund dollars from Orange County. But there is every indication from the federal government that any of those related expenses will be reimbursable. So all of the details under the Biden administration now are being worked out. So that's the good news. We can get you the dollars. We have a contractual agreement for the staffing, et cetera. So we'll get you those numbers.
This next question was texted in for Dr. Pino from Megan Cruz from WFTV. The question reads, the CDC now says a provider can switch from one vaccine to the other if the same vaccine isn't available at the time of the second dose, and that a provider can wait up to 6 weeks instead of the respective 3 or 4 weeks for the second dose. Is Orange County already scheduling people out longer than the 3 or 4 weeks? And do you foresee possibly having to switch between vaccines?
So from the beginning, we decided technically to, the computer system that we have in place your second appointment within a range. And that range is not longer than 28 days. It could be a little bit, it could go in some cases 29, 30 days, but it should be around 28 days for both vaccines. We didn't know that the CDC was to publish this, but we knew that it was safe to do it that way from the reading that we have done. And we did it that way to avoid overlapping first and second dosage from different vaccines. Now, the CDC also said that if you, both vaccines are very identical. They use different elements of the different proteins of the virus to develop the immunity, but they use the same approach. So that makes it not unsafe to receive one or the other one or a mix of both. But the indication is also as much as we can to adhere to one brand. And for the seniors, it's going to be difficult to explain. You got Moderna, all that I have is Pfizer. With all that in mind, we are not expecting to have to switch between vaccines. But it could be that one day we have not received a shipment, we have something else in the storage, and we will use it if the people agree to take it that day. Of course, people will have the choice of taking it or not.
Thank you. And this last one is for you, Dr. Pino, too, from Ryan Lynch in the Orlando Business Journal. His question reads, Seminole County has opened up a vaccination site in a former Sears. Could Orange County consider old retail spaces as a vaccination site?
Yeah, the answer to that is yes. We could consider that, although, again, our county is quite large, and this model that we are using guarantee that we could put through a lot of people in one single shot of time. The other issue is that we prefer our seniors not to walk, to use walker in level parking lots and other spaces. So the considerations were a little bit different. But we conducted a close pod with the schools on Sunday. They vaccinated over 400 people, 343, is that the number? 343. UCF also conducted a close pod last week. they vaccinated over 1,000 individuals who are 65 years and older. And those are some of the different strategies. And the mayor also mentioned that we are going to the seniors, so some of the congregated housing. And in that, we avoid that other approach, although it's in consideration if we receive further inventory.
Okay, it appears that that was the final question. The next press conference that we will be having is on Thursday, January the 28th at 4:30. We'll see you then. Thank you all for joining us today.